In terms of testing, we must deal with the facts in front of us and ensure we continue to build the testing resources that we need. Dallas County has led with the ability to test for the coronavirus in its lab. The FDA today said that they have enough test kits by the end of next week to test 835,000 individuals, and they shipped enough test kits to test 245,000 individuals earlier this week. I'm dedicated to ensuring that our folks have the resources they need to serve our community, and that's why we allocated money to help our local officials in the funding bill signed today by the President.
Since there are no cases in Dallas County that have been identified, we're still in a containment mode. So we have been doing things. We've been monitoring any travelers that have come in from China. We've been checking them twice a day if they have any fever, any symptoms. We've been working with the healthcare providers and the healthcare community to make sure that they know the latest CDC recommendations, what are the recommendations for testing. If anyone did develop symptoms, we would work on them to get those specimens collected. Because, as I said, we're in containment mode now, but it's not a time to panic, but what it is a time for is to prepare. And so this is our opportunity to really work with our partners. We don't know how things will progress. There are a lot of, as you've heard, it's an evolving situation. Every day things are changing, but we need to be prepared, but not panic. And so that's what we're talking to people, even, citizens, schools. If the schools had to close, what are you going to do about childcare? What are the realities? What are your arrangements for teleworking and to decrease having to go into the office? Or what are your leave policies for employees? Because we want people, one of the recommendations, if you're sick, stay home. We don't want their sick leave policies to be, discourage people from staying home if they're sick, and making sure all of these things, these recommendations are in place.
We have to recognize that about 20% of folks in Dallas County don't have health insurance, and we don't want to have that be an impediment to folks getting tested and then getting treated, because then it's going to have the opposite incentive in terms of spreading this virus around our community. And so we did appropriate a large amount of money to reimburse states and municipalities for costs they're going to incur as a part of this, and Parkland is certainly going to be a big part of that for us here in Dallas County. They'll certainly be incurring some costs of folks coming in. So to anyone out there who feels like they are ill and want to get tested, you still should proceed and try and do that, whether or not you have insurance or underinsured, and we're going to do everything we can to make sure that we cover the costs for us as a community. Labs and the testing are going to be the bottleneck. That's certainly true, but in our meeting with Vice President Pence and the team that the White House has put together to deal with this, I know that they have visited all of the major testing companies that are out there, like Quest and others, and are working closely with them to up their capacity. And so I really think we're going to see government and business working very closely to try and make sure that we can get our testing capacity up.
So we're still getting this, getting this going. I mean, we have very limited, supply, capability right now. We're trying to ramp it up. We just got this emergency purchase of the lab equipment that we're getting installed and trying to get online. But it's an evolving process. We're trying to do as much as we can, but it is limited. I think probably for the mass volumes where you're going to see that capability increase is with the commercial availability. So right now for us with public health purposes, for the investigations that we're doing, if we can turn it around more quickly and not have to wait days, as for instance, if someone is, there's a fear that someone's exposed to this and that investigation, then those people don't have to necessarily be in isolation for as long. We can address those issues by getting a quicker turnaround on some of the lab tests.